Question 1. A 68-year-old male is found unresponsive, pulseless, and apneic. High-quality chest compressions should be initiated at what depth for an adult patient? A. At least 1 inch. B. At least 1.5 inches. C. At least 2 inches, but no more than 2.4 inches. D. At least 2.5 inches, but no more than 3 inches. Answer: C. At least 2 inches, but no more than 2.4 inches. This question tests knowledge of high-quality CPR guidelines, specifically the required depth for adult chest compressions, a critical skill in cardiac arrest management. The key clue is high-quality chest compressions for an adult patient. Current guidelines emphasize compressing the chest at least 2 inches 5 centimeters but no more than 2.4 inches 6 centimeters to ensure adequate blood flow without causing excessive injury. For example, if compressions are too shallow, they won't pump enough blood, and if too deep, they could damage internal organs. Always remember that effective compressions are deep enough to be effective, but not so deep they cause harm. Question 2. You are assessing a 45-year-old male complaining of sudden onset, crushing chest pain radiating to his left arm. He is pale, diaphoretic, and states he feels lightheaded. What is your immediate primary concern? A. Administering aspirin. B. Obtaining a 12-lead ECG. C. Recognizing and managing potential acute coronary syndrome. D. Transporting quickly to the nearest cardiac center. Answer: C. Recognizing and managing potential acute coronary syndrome. This question focuses on the immediate priorities in managing a patient with classic symptoms of a heart attack or acute coronary syndrome. The keywords crushing chest pain, radiating to his left arm, pale, diaphoretic, and lightheaded strongly suggest cardiac compromise. While administering aspirin, obtaining an ECG, and rapid transport are all crucial interventions, the immediate primary concern is always to recognize the life-threatening condition and begin appropriate management, which then guides all subsequent actions. Your initial assessment and recognition are the foundation for everything else, so always connect the patient's symptoms to the most likely underlying emergency. Question 3. A 24-year-old male was involved in a high-speed motor vehicle collision. He is unresponsive, has a GCS of 3, and is hypotensive with a BP of 70/40 millimeter of mercury. His airway is patent, and he is breathing shallowly at 26 breaths per minute. Which of the following is the most appropriate initial airway maneuver? A. Head tilt, chin lift. B. Jaw thrust maneuver. C. Oropharyngeal airway insertion. D. Nasopharyngeal airway insertion. Answer: B. Jaw thrust maneuver. This question evaluates the understanding of airway management in trauma patients, specifically when spinal injury is suspected. The keywords high-speed motor vehicle collision and unresponsive immediately raise concern for potential cervical spine injury. In such cases, the jaw thrust maneuver is the preferred initial airway maneuver because it opens the airway without extending or rotating the neck, thereby minimizing potential movement of a compromised spinal column. While the head tilt, chin lift is standard for medical patients, it is contraindicated when spinal injury is possible. Remember, in trauma, suspect spinal injury until proven otherwise, and use the jaw thrust to protect the spine. Question 4. You arrive on scene to a 60-year-old female complaining of severe shortness of breath. She has a history of COPD and is on home oxygen. Her SpO2 is 88%. What is the most appropriate oxygen delivery device for this patient? A. Nasal cannula at 2 to 4 liters per minute. B. Non-rebreather mask at 10 to 15 liters per minute. C. Venturi mask at 28% or 35%. D. Simple face mask at 6 to 10 liters per minute. Answer C. Venturi mask at 28% or 35%. This question tests your knowledge of oxygen delivery methods, particularly for patients with chronic obstructive pulmonary disease, COPD. The keyword COPD is crucial because these patients may rely on hypoxic drive for breathing, meaning too much supplemental oxygen can depress their respiratory effort. A Venturi mask is ideal because it delivers a precise, fixed concentration of oxygen, which is essential for COPD patients to avoid overoxygenation while still improving their SpO2. Unlike other masks that deliver variable concentrations, the Venturi mask allows careful titration to maintain their SpO2 within an appropriate target range, like 88 to 92%. Always remember that for COPD patients, precision in oxygen delivery is key. Question 5. Which of the following is the primary purpose of the rapid full-body scan during the secondary assessment of a trauma patient? A. To identify all non-life-threatening injuries. B. To find and manage all specific injuries. C. To identify hidden life-threatening injuries. D. To document all injuries for hospital staff. Answer C. To identify hidden life-threatening injuries. This question focuses on the critical purpose of the rapid full-body scan in the secondary assessment of a trauma patient. The key phrase primary purpose emphasizes that you're looking for the most important reason for this quick, systematic head-to-toe examination. While all injuries eventually need to be documented and managed, the immediate goal of the rapid scan is to quickly uncover any significant, potentially life-threatening injuries that might have been missed or not immediately apparent during the primary assessment. For example, a hidden flail segment or penetrating injury to the abdomen could be rapidly identified and addressed. Always prioritize finding and treating immediate life threats during your trauma assessment. Question 6. A 3-year-old child presents with a sudden onset of stridor, drooling, and a high fever. The child appears anxious and is sitting upright, leaning forward with the neck hyperextended. What condition should you suspect? A. Croup. B. Bronchiolitis. C. Epiglottitis. D. Asthma exacerbation. Answer C. Epiglottitis. This question describes a classic presentation of epiglottitis, a serious and life-threatening airway emergency in children. The combination of sudden onset, stridor, drooling, high fever, and the characteristic sitting upright, leaning forward with the neck hyperextended, often called the tripod position, are strong indicators. Unlike croup, which typically presents with a barking cough and lower fever, epiglottitis causes severe upper airway swelling that can rapidly obstruct breathing. Remember that for children presenting with these symptoms, minimizing agitation and avoiding any manipulation of the airway are critical to prevent complete airway closure. Question 7. You are managing a patient with suspected opioid overdose. The patient is unresponsive, has shallow respirations at 6 breaths per minute, and pinpoint pupils. What medication is indicated for this patient? A. Albuterol. B. Aspirin. C. Nitroglycerin. D. Naloxone. Answer D. Naloxone. This question tests the recognition and appropriate treatment of an opioid overdose. The key indicators are unresponsive, shallow respirations at 6 breaths per minute, indicating respiratory depression, and pinpoint pupils, which are classic signs of opioid toxicity. Naloxone is an opioid antagonist that rapidly reverses the effects of opioid overdose, particularly the life-threatening respiratory depression. Administering naloxone, via intranasal or intramuscular routes, can quickly restore spontaneous breathing and consciousness in these patients. It's crucial to administer naloxone early when opioid overdose is suspected to prevent respiratory arrest and brain injury. Question 8. A patient is exhibiting signs of compensated shock, including cool, clammy skin, pallor, and a rapid, weak pulse. What is occurring physiologically to maintain blood pressure and perfusion in this stage? A. Vasodilation. B. Increased capillary permeability. C. Activation of the sympathetic nervous system. D. Decreased heart rate. Answer: C. Activation of the sympathetic nervous system. This question assesses the physiological mechanisms behind compensated shock, a crucial concept in understanding and managing hypoperfusion. The keywords compensated shock and maintain blood pressure and perfusion indicate that the body is still actively trying to cope with the circulatory compromise. In compensated shock, the sympathetic nervous system releases hormones like epinephrine and norepinephrine, causing vasoconstriction, narrowing of blood vessels, and an increased heart rate and contractility to shunt blood to vital organs and maintain blood pressure. This compensatory mechanism is why the skin becomes cool and clammy due to peripheral vasoconstriction. Understanding this helps you recognize the subtle signs of shock before it becomes decompensated. Question 9. You are ventilating an apneic adult patient with a bag valve mask, BVM. What is the appropriate ventilation rate for this patient? A. 8 to 10 breaths per minute. B. 10 to 12 breaths per minute. C. 15 to 20 breaths per minute. D. 20 to 24 breaths per minute. Answer: B. 10 to 12 breaths per minute. This question pertains to the correct ventilation rate for an apneic adult patient using a bag valve mask, a fundamental skill in airway management. The keyword apneic adult indicates a patient who is not breathing and requires full ventilatory support. The recommended rate for an adult is 1 breath every 5 to 6 seconds, which translates to approximately 10 to 12 breaths per minute, without hyperventilating the patient. Hyperventilation can lead to gastric distension, decreased venous return to the heart, and reduced cardiac output, which are all detrimental. Always remember to ventilate just enough to see visible chest rise and avoid overbagging. Question 10. According to the 2025 guidelines, which of the following is a critical component of post-cardiac arrest care once return of spontaneous circulation, ROSC, is achieved? A. Immediate administration of epinephrine. B. Aggressive hyperventilation. C. Targeted temperature management, TTM. D. Placing the patient in the Trendelenburg position. Answer: C. Targeted temperature management, TTM. This question highlights a vital aspect of modern post-cardiac arrest care aimed at improving neurological outcomes. The keyword post-cardiac arrest care and return of spontaneous circulation, ROSC, indicate that the patient's heart has restarted, and the focus shifts to preserving brain function. Targeted temperature management, TTM, which involves cooling the patient to a specific temperature, example 32 to 36 degrees Celsius, for a period of time, is a critical intervention shown to improve neurological recovery after cardiac arrest. This helps protect the brain from injury by reducing its metabolic demand and inflammation. Think of it as giving the brain a chance to recover and heal after the immense stress of a cardiac arrest. Question 11. You are called to a construction site for a 50-year-old male who has fallen from a ladder. He is conscious but complaining of severe back pain and numbness/tingling in both legs. Which of the following is the most appropriate next step in managing this patient's immobilization? A. Rapidly move him to the stretcher for transport. B. Apply a cervical collar and maintain manual inline stabilization. C. Allow him to sit up if it's more comfortable. D. Have him stand and lean against a wall while you assess him. Answer B. Apply a cervical collar and maintain manual inline stabilization. This question assesses the proper initial management of a patient with suspected spinal injury. The keywords fallen from a ladder, severe back pain, and numbness/tingling in both legs are strong indicators of potential spinal cord injury. The most appropriate immediate action is to apply a cervical collar and maintain manual inline stabilization to prevent any further movement of the spine until the patient is fully secured on a backboard or vacuum mattress. Any unnecessary movement could worsen a spinal injury, leading to permanent neurological damage. Always remember the principle of manual then mechanical stabilization for suspected spinal trauma. Question 12. A 72-year-old female complains of sudden onset, severe, tearing back pain that radiates to her legs. She is pale, diaphoretic, and has a weak, rapid pulse. You also note a difference in blood pressure between her arms. What life-threatening condition should you suspect? A. Myocardial infarction. B. Kidney stones. C. Abdominal aortic aneurysm, AAA, dissection. D. Sciatica. Answer C. Abdominal aortic aneurysm, AAA, dissection. This question presents a classic and critical presentation of an abdominal aortic aneurysm, AAA, dissection, a truly life-threatening vascular emergency. The keywords sudden onset, severe, tearing back pain, radiates to her legs, and especially the difference in blood pressure between her arms are hallmark signs. A dissecting aorta involves the inner layers of the largest artery tearing apart, and rapid recognition and transport are paramount. While other options might cause back pain, the tearing quality, associated shock signs, and blood pressure discrepancy are highly indicative of an AAA dissection. Always have a high index of suspicion for a dissecting aneurysm with this constellation of symptoms, as it requires immediate surgical intervention. Question 13. You are preparing to administer activated charcoal to a conscious adult patient who has ingested an unknown substance. What is the primary contraindication for administering activated charcoal? A. Ingestion of petroleum products. B. Ingestion of acetaminophen. C. Ingestion of aspirin. D. Ingestion of ibuprofen. Answer A. Ingestion of petroleum products. This question tests knowledge of contraindications for activated charcoal administration, a crucial aspect of toxicology management. The keyword primary contraindication asks for the most important reason to withhold this medication. Activated charcoal works by binding to ingested toxins, but it is generally contraindicated for petroleum products, like gasoline or kerosene, and caustic substances, like strong acids or alkalis, because it does not bind effectively to them and can worsen harm if aspirated into the lungs. If a patient with petroleum ingestion vomits charcoal, there's a significant risk of aspiration pneumonitis. Always ensure the substance ingested is one that charcoal can effectively bind to and that the patient has a protected airway. Question 14. Which of the following best defines implied consent in emergency medical care? A. Consent given by a minor's parent or legal guardian. B. Consent given when a patient explicitly states their permission for treatment. C. Consent assumed for an unconscious, incapacitated, or gravely ill patient who needs immediate life-saving treatment. D. Consent provided in writing by the patient before the emergency occurs. Answer C. Consent assumed for an unconscious, incapacitated, or gravely ill patient who needs immediate life-saving treatment. This question explores the concept of implied consent, a fundamental legal principle in emergency medicine. The keyword implied consent refers to situations where direct consent cannot be obtained, but the patient's condition necessitates immediate intervention to prevent loss of life or limb. It is assumed that a reasonable person in that situation would want life-saving care. For example, if you find an unresponsive patient after a car crash, you have implied consent to provide necessary medical care. This principle allows emergency responders to act quickly in critical situations when a patient cannot provide verbal consent. Question 15. You are assessing a patient who complains of a worst headache of my life and has a sudden decrease in level of consciousness, unilateral weakness, and unequal pupils. What condition should you suspect? A. Migraine headache. B. Ischemic stroke. C. Hemorrhagic stroke. D. Seizure disorder. Answer: C. Hemorrhagic stroke. This question describes the classic presentation of a hemorrhagic stroke, a severe and life-threatening type of stroke. The keywords worst headache of my life, sudden decrease in level of consciousness, unilateral weakness, and unequal pupils are all strong indicators of bleeding within the brain. While an ischemic stroke can also cause sudden weakness, the severe thunderclap headache and rapid decline in consciousness are more characteristic of a hemorrhagic event due to increased intracranial pressure. For example, a ruptured aneurysm would cause this sudden, severe headache. Recognizing these distinct signs is vital for rapid transport to a stroke center. Question 16. What is the primary purpose of continuous positive airway pressure, CPAP, in respiratory distress? A. To deliver high-flow oxygen only. B. To prevent gastric distension. C. To force fluid out of the lungs and keep alveoli open. D. To assist with bronchodilation. Answer: C. To force fluid out of the lungs and keep alveoli open. This question assesses the fundamental mechanism of action for CPAP, a common intervention for specific types of respiratory distress. The keywords primary purpose and respiratory distress guide you to understand its main benefit. CPAP delivers a constant positive pressure to the airway, which helps to push fluid back into the capillaries in patients with pulmonary edema and prevents the tiny air sacs, alveoli, from collapsing at the end of exhalation, thereby improving gas exchange. For example, in a patient with congestive heart failure, CPAP can significantly improve breathing by reducing the fluid burden in the lungs. Remember that CPAP is about maintaining pressure to improve oxygenation and ventilation, not just delivering oxygen. Question 17. During a medical patient assessment, what does the P in the sample history stand for? A. Pain assessment. B. Past medical history. C. Prior events. D. Prescribed medications. Answer: B. Past medical history. This question tests knowledge of the sample mnemonic, a foundational tool for gathering patient history in both medical and trauma assessments. The P in sample specifically refers to the patient's past medical history, which includes any existing medical conditions, previous surgeries, or significant illnesses. This information is crucial for understanding the patient's current presentation and potential complications. For example, knowing a patient has a history of diabetes or heart disease significantly guides your assessment and treatment plan. Always remember that a thorough history helps you piece together the puzzle of the patient's current condition. Question 18. An adult patient is experiencing severe anaphylaxis after a bee sting, presenting with widespread urticaria, wheezing, angioedema of the face, and a blood pressure of 80/50 mmHg. What is the most appropriate initial medication to administer? A. Diphenhydramine, Benadryl. B. Albuterol. C. Epinephrine. D. Dexamethasone. Answer: C. Epinephrine. This question describes a critical presentation of anaphylaxis, a severe allergic reaction, and asks for the most appropriate initial medication. The keywords severe anaphylaxis, widespread urticaria, wheezing, angioedema, and blood pressure of 80/50 millimeter of mercury, indicating hypoperfusion/shock, are all classic signs of a life-threatening systemic reaction. Epinephrine is the medication of choice for anaphylaxis because it rapidly reverses airway swelling, causes bronchodilation, and increases blood pressure and heart rate. It works by constricting blood vessels and relaxing airway muscles, counteracting the effects of the allergic reaction. Always administer epinephrine immediately in cases of severe anaphylaxis. It is a life-saving drug. Question 19. You are assessing an 8-month-old infant with a chief complaint of fever, poor feeding, and irritability. According to the Pediatric Assessment Triangle, PAT, which side of the triangle are you assessing when noting the infant's general appearance and level of alertness? A. Appearance. B. Work of breathing. C. Circulation to skin. D. Mental status. Answer: A. Appearance. This question tests understanding of the Pediatric Assessment Triangle, PAT, a rapid, non-invasive tool used to form an initial impression of a child's condition. The keyword general appearance and level of alertness directly corresponds to the appearance side of the PAT. Appearance reflects the child's neurological and respiratory status and includes factors like tone, interactiveness, consolability, gaze, and speech/cry. For example, a child who is listless and unresponsive would indicate a poor appearance, prompting immediate concern. The PAT allows you to quickly identify how sick a child is without even touching them. Question 20. Which of the following accurately describes a critical intervention for a patient experiencing attention pneumothorax? A. Application of an occlusive dressing to the chest wound. B. Needle decompression of the affected side. C. Administration of high-flow oxygen via non-rebreather mask. D. Immediate insertion of an advanced airway. Answer: B. Needle decompression of the affected side. This question focuses on the definitive pre-hospital management of attention pneumothorax, a life-threatening chest injury. Attention pneumothorax occurs when air enters the pleural space but cannot escape, causing increasing pressure that collapses the lung and shifts the heart and great vessels, impairing circulation. The only truly critical intervention in the field to relieve this pressure and restore circulation is needle decompression, which allows the trapped air to escape. While other interventions like oxygen are supportive, needle decompression directly addresses the underlying cause of the hemodynamic compromise. Remember, this is a time-sensitive, life-saving procedure to decompress the chest. Question 21. What is the most important consideration for scene safety when approaching a motor vehicle collision with downed power lines? A. Approaching from the uphill side. B. Remaining at least one full span away from the downed lines. C. Immediately trying to move the lines with a non-conductive object. D. Directing traffic around the scene until power is restored. Answer: B. Remaining at least one full span away from the downed lines. This question emphasizes a critical aspect of scene safety, specifically regarding electrical hazards at a motor vehicle collision. The keywords downed power lines highlight the extreme danger of electrocution. The most important consideration is maintaining a safe distance, generally defined as at least one full span, the distance between two utility poles, away from the downed lines, or further if unsure, because the ground can be energized. Trying to move lines or directing traffic too close can put responders and bystanders at extreme risk. Always remember that you cannot help the patient if you become a patient. Prioritize your safety from electrical hazards above all else. Question 22. A 35-year-old male is found unconscious with a strong odor of alcohol on his breath. His blood glucose level reads 40 milligrams per deciliter. What is the most appropriate initial intervention? A. Administer oral glucose. B. Administer intravenous dextrose 50%, D50. C. Administer intranasal naloxone. D. Place him in the recovery position and monitor. Answer: B. Administer intravenous dextrose 50%, D50. This question presents a patient who is unconscious and hypoglycemic, a common presentation, especially with alcohol involvement. The keywords unconscious and blood glucose level reads 40 milligrams per deciliter, which is critically low, are key indicators of a severe hypoglycemic emergency. Since the patient is unconscious, oral glucose is contraindicated due to the risk of aspiration. Therefore, the most appropriate intervention is to administer intravenous dextrose 50%, D50, which directly delivers glucose to the bloodstream to rapidly raise blood sugar levels. For example, if no 4 access is available, glucagon via intramuscular injection would be another option. Always ensure the patient has a patent airway and correct critical hypoglycemia in an unconscious patient with 4 glucose. Question 23. You are assessing a patient with a full-thickness burn to their entire left arm and left side of their trunk. Using the rule of 9s for adults, what percentage of their total body surface area, TBSA, is burned? A. 9%. B. 18%. C. 27%. D. 36%. Answer: C. 27%. This question tests your ability to rapidly estimate the percentage of total body surface area, TBSA, burned using the rule of 9s, a crucial skill for burn assessment in adults. For an adult, the entire left arm accounts for 9% TBSA. The entire trunk, front and back, accounts for 36% TBSA, so the left side of their trunk would be half of that, or 18%. Adding these together, 9% plus 18%, gives you 27%. Accurate TBSA estimation is critical for guiding fluid resuscitation and determining transport to a burn center. Remember that the rule of 9s applies to adults and different percentages are used for pediatric patients. Question 24. Which of the following is the most definitive way to confirm proper placement of an endotracheal tube, ET tube, in the field? A. Bilateral chest rise and fall. B. Auscultation of equal breath sounds bilaterally. C. Visualization of the tube passing through the vocal cords. D. Continuous waveform capnography. Answer: D. Continuous waveform capnography. This question addresses a critical aspect of advanced airway management, confirming endotracheal tube, ET tube, placement. While bilateral chest rise, equal breath sounds, and visualizing the tube pass through the vocal cords are important initial indicators, continuous waveform capnography is the most definitive and reliable method to confirm proper ET tube placement in the trachea. Capnography continuously measures the carbon dioxide expelled with each breath, providing a waveform that confirms ventilation of the lungs and rules out esophageal intubation. Always rely on waveform capnography for ongoing confirmation of ET tube placement, as other signs can be misleading. Question 25. A 6-month-old infant is conscious but suddenly unable to cry or cough after playing with a small toy. The infant is making high-pitched inspiratory noises. What is the most appropriate initial intervention? A. Abdominal thrusts. B. Back blows and chest thrusts. C. Finger sweeps. D. Begin CPR compressions. Answer: B. back blows and chest thrusts. This question describes a conscious infant experiencing a severe foreign body airway obstruction, FBAO. The keywords 6-month-old infant, unable to cry or cough, and high-pitched inspiratory noises, indicating inadequate airflow, are classic signs of a severe obstruction. For infants, defined as less than 1 year old, the recommended intervention for a severe FBAO is a sequence of 5 back blows followed by 5 chest thrusts, repeated until the object is expelled or the infant becomes unconscious. Abdominal thrusts are not recommended for infants due to the risk of organ damage. Remember that gentle but firm techniques are crucial for dislodging the obstruction in infants.